Good morning, good afternoon, and good evening, everyone. Want to welcome you all to the CDC Field Epidemiology Training Program webinar series. Today, you are joining us for part 2 of our August technical webinar. Next slide. The Field Epidemiology Training Programs, or FETPs, are competency-based training programs that strengthen the epidemiologic capacity of the global public health workforce in more than 90 countries globally. FETP fellows and graduates detect and stop outbreaks, they improve surveillance systems, and they strengthen public health programming across both infectious and non-infectious diseases. Every month, we will showcase a photo from a different FETP program on this slide. Today, we are showing a photo from Dharmesh Arya from the India FETP program. This photo shows the advanced FETP India officers conducting house-to-house data collection during an outbreak of Chandipura virus in Gujarat and Rajasthan, India in 2024. And since I forgot on the opening slide, hello everyone, I'm Dr. John Rosso with the US CDC's FETP program, leading the One Health curriculum development, and I'm happy to be hosting this webinar with you today. We're going to go to the next slide. CDC's Global Workforce Development Branch has a range of virtual content to support field epidemiology training programs. These include our monthly global Zoom calls between CDC headquarters and our field FETPs, and two different types of webinar series. These are the quarterly FETP Programmatic and Soft Skills webinar series, and the monthly FETP Technical webinar series. Today's webinar is part of the latter, the FETP Technical Webinar Series. For more information about any of these, you can email askgwdb@cdc.gov. And for today's webinar, we will have 90 minutes. We'll have approximately 1 hour of presentations and 30 minutes of question and answer afterwards. There is live interpretation available for today's webinar in Spanish, French, Portuguese, and Russian. On the lower part of the screen in your navigation bar, you can choose your preferred language. We will also be asking for a very short evaluation of today's webinar. The evaluation is required if you would like to receive a certificate of completion for the webinar. The link to the evaluation will be shared in the chat box on the right throughout the webinar and will be shared once again on screen at the end of the webinar. Next slide. During today's webinar, there we go. During today's webinar, we want to remind everyone who has questions to please use the Q&A box. Please do not use the chat box. The Q&A button is available, as you can see here, at the bottom of your Zoom screen. If you ask a question in the chat instead, the presenter may not see it. Next slide. And with that, I would like to introduce today's presenters, Dr. Kira Nestor and Dr. Julia Earle Richardson. Dr. Kira is a health scientist with the National Center for Emerging and Zoonotic Infectious Diseases at the CDC. She has a background in psychology, evaluation, and social science data analysis. And Dr. Julia leads the social and behavioral science team. Her background is in epidemiology and behavioral science, and she has extensive global health experience. So without further ado, I will hand the presentation over to Dr. Kira to start today's technical webinar.
Great, thanks so much, John. So today's webinar is Qualitative Data Analysis for Field Epidemiology. Today is a continuation of the webinar presented on August 6th. In that talk, Dr. Valerie Mack and Dr. Julia Earle Richardson presented on collecting qualitative data as part of a case investigation and on getting started with qualitative analysis of the data collected. Today's webinar continues the qualitative data analysis portion of the presentation. I will present on text coding for qualitative analysis, And then Julia will present on building themes for qualitative analysis. By the end of this webinar, you will be able to use text data to improve insight into communities experiencing an infectious disease outbreak. Our learning objective for part 3 of the webinar is to learn to code text from several qualitative text files using our measles example. In the last webinar, we continued a scenario first presented by Julie Harris in a presentation last year. The scenario imagined that you are a health officer working in a district where there has been an infectious disease outbreak. As the scenario progressed, it was discovered to be a measles outbreak. Dr. Valerie Mack discussed how to collect qualitative data for field investigation. Our imaginary epidemiologist, Ellie Epi, investigated the measles outbreak. She collected information through taking field notes in case investigations, conducting in-depth interviews, and leading focus groups to learn more about social factors that may contribute to measles transmission in the community. You will remember seeing this page before as the start page of the CDC Excel tool for thematic analysis. In the second half of the last webinar, Dr. Julia introduced the Excel tool for thematic analysis. This is an Excel file that contains 10 specially designed worksheets to help you do qualitative analysis. She talked about the setup phase of using this tool. In this phase, we use the first 5 sheets of the tool. First, you use the planning worksheet to define what you wanted to learn from the text. Second, you use the transcript log sheet to organize the text data. Third, on the Select Coding Scheme worksheet, you selected a pre-developed measles coding scheme, which is a list of the possible text codes we will use in the rest of the webinar. We will review this coding scheme again today on the coding scheme sheet. And finally, you formatted and imported text into the coding workspace sheet so that each text sentence appeared on its own line. Today, I will cover the next stage of this analysis, coding. We will use 3 worksheets in this stage. First, the coding workspace sheet to code our data. Then, once we have finished coding all of our data, we will use the coding tables and quote sheet to look at the most commonly mentioned ideas in the text data. Before we get back to using the Excel tool, let's review some information Julia previously covered about text coding to remind us why we're doing this. Text coding is a way to organize and understand information that people share in words. Remember, text coding is not about numbers. It is about understanding what people think, feel, and experience. When we collect notes, interviews, or comments, we have a lot of sentences. Text coding helps us organize these large amounts of information. This organization process makes it easier to see what people are talking about and to find patterns. We can quickly see what topics or concerns are most common and find important quotes or ideas. This coding step will help us prepare for the next step, finding bigger patterns called themes. Dr. Julia will cover this in the final part of the webinar today. Let's also review some key terms that Julia introduced last time. Text data is any information written or spoken by people, such as notes, interviews, or comments. For our example, we will use the data collected by Ellie Epi in her measles case investigation through field notes, in-depth interviews, and focus groups. A text segment is a sentence or a short part of the text that has an important idea. We decide whether an idea is important based on whether it can help us answer our question. For our example today, we will continue answering the question from last time. What social factors may have contributed to the transmission of measles? A text code is a short label or phrase that describes the main idea in a text segment. And a coding scheme is a list of text codes we can choose from. It helps us use the same words for similar ideas. We will provide examples of text codes and a coding scheme later in the example. I also want to share some principles of qualitatively coding text. First, coding is done following a step-by-step process. We will walk you through the steps in this presentation. It is important to understand the steps so that each piece of text that is coded goes through the same process. The process may seem very slow at first. As you practice, you can code text more quickly. We have tested using AI to help us with these steps and found it is important to learn to code manually before using AI. Once you know what the steps are and understand why they are important, AI can help you work faster. So, a few do's and don'ts recommendations to keep in mind while you are coding. The first do is to keep your question in mind. It is important that throughout the process, you keep our question, what social factors may have contributed to transmission of measles, in mind. We developed this question during the planning phase of the process. You will only want to code text that relates to our question. Text coding means giving labels to ideas in the text that help you find answers. Here is an excerpt from an in-depth interview with the mother of the first 2 measles cases. She said, "When I visit family, they usually share a few important things to help me plan. They often tell me about the weather, so I know what clothes to pack." As we read this, we will keep in mind our research question and ask ourselves, does this relate to that question? This mother is talking about how she communicates with her family before visiting them, including finding out about the weather. This is not related to the transmission of measles, and so we will not apply any text code to it because it is unrelated to our research question. Another on our list of do's and don'ts is to remember that there is no perfect code, only a reasonable code. Different people may choose different codes, and that's okay. What matters is that your coding makes sense and another person can understand your choices. The goal is to find the main ideas in the text and categorize them with a text code to the best of your ability. Here is a quote from a focus group with parents in school A. This parent said, "In my case, I tried to take my child, but when we got to the clinic, they said they were out of vaccines and I couldn't return the next week because of work." We had 2 people who were separately coding this information using the measles coding scheme. A reminder that a coding scheme is a list of possible text codes to choose from. The first coder may have read the text and decided that the best text code to fit the main idea in this piece of text is related broadly to vaccination, and more specifically, that vaccination is hard to access because of available hours. That is a reasonable code to apply to this text segment. Another coder may have read the same piece of information and decided that this text is broadly related to medical diagnosis and care, and more specifically, that healthcare is not easily accessible. This is also a reasonable code. We want to stress that neither of these codes were incorrect. They are both reasonable codes. Sometimes both codes are correct, and it's best to use both so all ideas are included. Coders can also change or improve the codes to make the differences clearer. The most important thing is that the codes match what the text is really saying. Finally, one don't. Don't guess what the text means. Only use codes for ideas that are clearly stated. If the text is unclear or difficult to understand, then don't assign it a code that may not fit the text. For example, let's look at what that same mother from our earlier example said about gatherings when visiting her family. They also let me know about any special events or gatherings happening while we're there. In our measles investigation coding scheme, there is a broad code called community environment and a specific code called people gather in close groups often. Someone might try to use these codes for the mother sentence, but this is not correct. Why? First, we already decided that the mother is not talking about the measles outbreak. Second, she mentions gatherings, but we do not know if these gatherings involve close contact or if they happen often. If we were to code this text, we are making assumptions that are not supported by what she said. So now that we've talked about the principles behind qualitative text coding, we are ready to go back to our Excel tool and get started coding text segments in the coding workspace. For this process, we will use the coding scheme and coding workspace sheets. There are 4 steps for coding text segments. I will describe how to do each of these steps in detail. To give you an overview, first, we will review the coding scheme and familiarize ourselves with it. Then, we will open the coding workspace sheet, read the first text segment, and decide whether it is related to our research question. If it is related, we will move on to step 3, where we will apply a text code to the first idea in the text segment. And finally, before moving on to the next text segment, we will look for more ideas in the current piece of text. We will start with step 1, reviewing the coding scheme. Let me remind you what a coding scheme is and why we need one. A coding scheme is a list of codes we use during text coding. It is usually developed before you start coding. It is useful to make sure that we are consistently using the same labels and phrases to code the same idea. For example, in this excerpt from the field notes document, they said that the initial case was a 9-month-old unvaccinated female who traveled to an area experiencing a measles outbreak. Without a coding scheme, one coder may say the text code is not vaccinated, and another coder may say unvaccinated. Both descriptions are correct. These words mean the same thing, but using different text codes will make it difficult for us to analyze the code. Developing a coding scheme ahead of time means that while text coding, we are picking from a limited number of possible labels to avoid this kind of confusion. The coding scheme helps us to stay organized. We will not cover how to develop or set up a coding scheme in today's webinar, but we have YouTube videos available on the topic that we will provide links to in the chat at the end. For our coding example today, we will use the already developed and set up measles investigation coding scheme. So the first step, anytime you code text, is going to be to review your coding scheme so that you know what text codes are already available to you. Let's see how we do that in the Excel tool. From the start page, you will open this sheet entitled Coding Scheme. This is what you will see when you open the Coding Scheme page. When we code text, we use two types of text codes that are related to one another: broad codes and specific codes. Broad codes are big categories that describe the general topic of the sentence. For example, vaccination, medical care, or symptoms. Broad codes help us group similar topics together. We're going to zoom in a little bit to look at the structure of the coding scheme and what text codes have already been created. Let's start with the broad codes listed in this column. So now I've zoomed in on just the list of broad codes in the measles investigation coding scheme. You can see here we've set up 8 broad codes: measles characteristics, child characteristics, family environment, school environment, community environment, medical diagnosis and care, vaccination, and public health communication. Going back to our zoomed out coding scheme page, across the top of this row here, you can see each of our 8 broad codes. Under each of these broad code headings is a list of specific codes. Specific codes give more detail about the idea in the sentence. Specific codes help us understand the details within each topic. For example, this is the heading for broad code number 1, measles characteristics. Under this broad code are the ideas that there hasn't been an outbreak in years, symptoms are similar to other diseases, it's very easily transmitted, and can be serious. Let's take one more example of a list of specific codes. In the list of broad codes, we see medical diagnosis and care. If we want to find the list of specific codes that exists under this broad code, we can look across the top row and find medical diagnosis and care listed here. Then, zooming in so we can read them, we see that under this broad code are 5 specific codes that include ideas such as clinic hours, making visits challenging, the cost of medical care, accessibility of healthcare, communication with clinic staff, and not receiving medical care. You will see in step 3 that for each idea in a text segment, we will apply one broad and one specific code to capture the idea that is being expressed. For now, step 1 is complete when you have familiarized yourself with the content of the coding scheme. This is important because you want to see what all the options are for text codes when you start. You should make sure the meanings of all the codes are clear to you. In the early stages of coding, you may also want to keep a copy of the coding scheme handy, either in a printed copy or on a second screen, so that you can quickly review it. Step 1 is complete when we have reviewed the coding scheme. We're moving on to step 2, where we read our first text segment, and then we decide if the idea in the text segment is related to our question, at which point we will move it into the text segments for coding column. If the text is not related to our question, we do not need to apply a code, and we can move on to the next text segment. For this step, we will go back to our coding workspace by opening this sheet. In Julia's previous webinar, you formatted and imported the text on this worksheet so that it looks like this. You can see that each text sentence is in its own row in the text sentences column. This is where we are going to start reviewing each text segment and determining whether it relates to our research question: what social factors may have contributed to transmission of measles? To start coding, we read the first sentence in the text sentences column. The initial case was a 9-month-old unvaccinated female who traveled to an area experiencing a measles outbreak. Is there an important idea related to measles transmission in this sentence? Yes, there are 3. The first one is that the initial case was an infant. The second is that she was unvaccinated. The third is that she had traveled to a place with a measles outbreak. Each of these ideas needs to be labeled with a text code. Let's start with the first idea that the initial case was an infant. Back in the coding workspace, I'm going to zoom in on these 4 columns as this is where the bulk of the coding takes place. The first thing we need to do once we've identified an idea that needs coding is copy the text segment we want to code from the text sentences column to the text segments for coding column. You do this by copying and pasting the text in the text sentences column into the text segments for coding column. So we have now completed step 2 by reading the first text segment, deciding that it is related to our question, and moving it into the text segments for coding column. We now move on to step 3, applying a text code to our first idea. This requires us to select a broad code and then a specific code under that broad code. Back in our coding workspace, to remind you, we've identified that the very first idea in this piece of text is that the initial case was an infant. We need to first choose a broad code that addresses the idea that the first case was an infant. The broad codes are big categories that describe the general topic of the sentence. When we select the broad code column, there's a drop-down menu that contains all the broad codes from our coding scheme, which is our list of possible text codes to choose from. Reading through these options, we decide that the idea of the initial case being an infant fits best under the child characteristics broad code. So we will click on child characteristics. And now we have this child characteristics broad code selected. Once we have selected a broad code, the process to selecting a specific code is similar. Specific codes give us more details about the idea in the sentence under the more general broad codes. Again, when we click into the list of specific codes, we will see all the possible codes that are available to us under the broad code of child characteristics. We will select the specific code age infant from this list, and now we have applied a broad and specific code to the idea that the initial case was an infant. So we've completed step 3, applying a text code to the first idea. We'll move on to step 4, where we look for more ideas in the text segment. If there are no more ideas, we move on to the next text segment. If there are more ideas that need to be coded, we add a new row and repeat step 3 until all ideas have been coded. So we have now coded this first idea that the initial case was an infant. But there are 2 additional ideas that we have yet to give a text code to. Remember that we want to be sure to apply as many text codes as needed to capture every idea expressed in the text. So we need to apply 2 more codes to this piece of text. Let's start with the idea that she was unvaccinated. I'll show you how to do this in the coding workspace. We need to add a new row between these 2 text segments so that we can add an additional code to the first text segment to cover the idea that the child was unvaccinated. We will right-click on the row below it to bring up this menu. We will then select Insert and then Table Rows above. We now have a blank row between these two text codes. This is where we will be able to add our additional code. First, we need to copy the information from the text sentences and text segments for coding from the first row into the newly added row. Again, we will copy and paste the information, but now we will move it from the first row into the second row. Now, this is just a repeat of what we did in step 3. We open the broad code drop-down menu. Again, select child characteristics, and we have supplied a broad code. Now we go into the specific code drop-down menu, select not fully vaccinated, and once we do that, we have now coded this additional idea. We've now coded the first 2 ideas. You may be thinking at this point that this seems to be taking a long time to code each of these ideas. This is because I've gone very slowly in lots of detail so you understand how it's done. Now I want to show you what this looks like in real time for coding the last idea, she traveled to a place with a measles outbreak. You can see here, we are going to add a new row in between the text segment we're currently coding, and then copy the information into that new row. Then we select child characteristics and previously traveled to a measles outbreak area. So you can see that only took a few seconds to complete, and once you have the hang of it, you'll be able to do it quickly too. So we've completed coding all the ideas in our first text segment and finished with step 4 of coding the text segment by coding all of the ideas. This means that we can move on to the next text segments in our text data file and code all of the text data that has been imported into the coding workspace. This is what your completed coding workspace sheet will look like once you've gone through all the text segments and applied broad and specific codes to each one of the relevant ideas. You can see some rows are blank, so these are text segments that are not related to our question and were not coded. You can also see we filled in the column named Interviewer Questions and section headings. This is a place to move any pieces of text not spoken by participants in the interviews or focus groups, but are important pieces of information to keep so you know what question was being responded to. Now we finished coding all of our text. So what do we do next? Now it's time to look at our results and see what we can learn from our codes. We will use tables and charts in Excel to help us organize, summarize, and explore our coded data. This will show us the main ideas and patterns in our information. There are pre-built tables and charts in the Excel tool that will help you explore this data. To find these tables, we will be using the coding tables and quotes sheets. Once you have finished coding all your text, the next step is to explore your results. We want to see which codes were used the most and which were used the least. This gives us a quick overview of all our data together. The Excel tool makes this easy by automatically creating tables and charts that summarize your codes. We'll start by displaying the coded data in tables and charts by opening the Coding Tables sheet. When you first open the Coding Tables sheet, the pre-built tables and charts will not have been updated with your coded data, so you will need to refresh these tables to reflect your coded data. First, click on the Data tab on the top of the ribbon, and then select Refresh All. This will update all the pre-built tables and charts with the most current information from the Coding Workspace sheet. You only have to do this if you have made changes to the information on the coding workspace sheet. Here's what it looks like once you refresh the data. This is a table of all the broad codes that were applied as text codes to our data. Remember, broad codes describe the general topic of the sentence. Let's zoom in a bit and look at what the most frequent broad codes were in our data. We can see here the top 3 broad topics were vaccination, community environment, and medical diagnosis and care. This gives us a clue that these topic areas represent most of the texts that we reviewed. We'll keep these bigger ideas in mind when we start developing our themes. This chart shows the same information, just in a graphical format. Pivot tables and charts show you which codes appear most often. This helps you see what is most important in your data. We also have a table of specific codes. These exist under the broad codes to give more detail about the ideas in our text. Let's see what our most frequently mentioned specific codes were. The top 3 most coded ideas in the text related to a lack of clear information about vaccines, vaccination negative stories and rumors, and that information passes informally. There is also a graph representing the frequency of specific codes. All of this information will be useful to you as you go through the process of creating themes with Dr. Julia. Before I turn it over to Julia, I want to show you one last sheet where you can see the text data sorted by their text codes. To do this, we'll open the quotes worksheet. This is what the quotes page will look like at this point. Let's first focus on this table. You can see that this is a list of all our broad codes, like we saw on the prior sheet. And again, vaccination is the #1 most frequently mentioned topic. This table is a little different because it has these plus signs next to each broad code. If we click on the first of these plus signs, we actually open the list of specific codes that are all about vaccination. This table shows broad codes and has an additional level of specific codes under the first broad code of vaccination. So now we can see that under the most frequently mentioned broad code of vaccination, the most frequently mentioned idea was a lack of clear information or understanding about vaccination. Now, if we were only interested in how often an idea had been mentioned in our text, we would be done with our analysis once we collected all the counts of these codes. But I'd like to remind you about what our definition of text coding said. It is not only about numbers, it is about understanding what people think, feel, and experience. So we need to better understand what exactly people were saying about vaccination and how this lack of information about vaccination may have contributed to our measles outbreak. To do that, we need to look at what people actually said about this topic. So there is another small plus sign next to the specific code, lack of clear information. If we click on it, it opens a list of all the text segments that were coded with this specific code. We still have our broad code on top, followed by the specific code. And now we can see the first of these 6 text segments under the specific code of lack of clear information. This type of consideration of what participants said, not just how often they said it, is what distinguishes qualitative from a purely quantitative analysis. Julia will go into more detail on how we turn this text information into themes. One last option for working with these tables that I want to introduce the idea of is to filter the tables using slicer boxes. Here I have closed up the text segments again, so we just have the broad and specific codes. And now I want to draw your attention to these boxes over here. Each of these boxes is what is called a slicer, and we can use the buttons in these boxes to filter the content of the table with the broad and specific codes. For example, maybe we are working directly with the local school district to help them find out what specific school factors contributed to measles transmission. So we may want to filter this table by just codes related to the school environment. We can use this broad code slicer to select the school environment broad code here. And now we have filtered our results table to only show the specific codes related to school environment. These type of filters allow you to quickly find quotes related to specific ideas by expanding the specific codes to look at text segments. We go into more detail about how to use these slicers and how to further customize these tables for analysis in our YouTube video tutorials, which will be linked in the chat. Thank you all for your attention so far. We've now wrapped up the coding section of the webinar, and I'm going to turn it over to Julia to cover the thematic analysis portion.
Hello, everyone. Thank you so much, Kara. Just give me a minute to connect my presentation. Okay. Can you see that okay?
Looks great.
Very good. Thank you. And everyone can hear me all right? Very
Yes, we
good.
can.
Wonderful. Well, thanks, Kara. During this part of today's webinar, we will learn how to develop themes based on coded text. We will continue to use the example of a measles investigation through the presentation. Kara showed you how to code text using the coding section of the CDC Excel tool, using Worksheet 5, Coding Workspace, Worksheet 6, Coding Tables, and Worksheet 7, Quotes. Now, I will show you how to do thematic analysis using Worksheet 8, Grouping Codes, Worksheet 9, Building Themes, and Worksheet 10, Results and Action Planning. Before we go to the Grouping Codes worksheet, I want to go back to Worksheet 7, the Quotes worksheet, and show you again a diagram that Kira just shared with you a few minutes ago. She showed you how the table on the right first lists the broad code, then the specific code, and then the coded text segments. Together, the specific code and all of the coded text segments underneath it make a coded text segment group. This is a really important concept because coded text segment groups are the building blocks for themes. Here is a diagram showing a theme and 3 coded text segment groups underneath it. All of the coded text segment groups relate to the theme and help us show why we have chosen this theme. Here's a brief overview of how building themes with coded text segments is done. Let's look at the first coded text segment group. The specific code is not fully vaccinated. And then the 2 text segments underneath are 9-month-old unvaccinated female and brother's vaccine history indicated 1 dose of vaccine. Taken together, this group is talking about children not being fully vaccinated. A possible theme comes to mind when I look at that coded text segment group. It seems that families are not engaging fully with the local health system. You could think of other themes. For example, you might think about issues with the vaccination program. But for now, I'm going to create a theme of families not engaging fully with the health system. Once I've looked through all of the rest of the coded text segment groups, I find that there are other text segment groups that also support this theme. The second coded text segment group shown here with the specific code of untreated illness, and then the two text segments, she did not receive medical care and he did not receive medical care, also fit the theme of families not engaging fully with the healthcare system. The third coded text segment group that has the specific code vaccination hard to access due to distance also seems to fit with this theme because it references people not being able to get to the health center easily. This may be partly an explanation of why this is happening. In a few minutes, I will show you how to do this in more detail. Right now, I just want you to remember that coded text segment groups are building blocks for themes. Now that we've talked about what coded text segment groups are and why they are important, we're ready to open the grouping codes worksheet. This page has 4 parts. First, we have a table. The text segments here are grouped by broad and specific codes. In a minute, I will show you how to open this and find our coded text segment groups. Over here on the right, we have several blank boxes for writing down our themes as we develop them, and for adding the coded text segment groups underneath each one. Next, in the upper right corner, the spreadsheet displays the research question that you wrote on your planning worksheet. And it is important to remind yourself frequently of your research question as you develop themes, since your themes are intended to help you answer that question. As you may remember, our question is, what social factors may have contributed to measles transmission in our community? Over here on the upper left, we have a slicer box. As Kira showed you on the quotes worksheet earlier, this slicer box allows you to filter your text segments in the table below, so that only text segments coded under certain broad codes appear. This is for use when you're only going to analyze part of your text data. It will hide the rest for you. We won't be using that slicer box today. So let's take a closer look at the text segments table. I'm zooming in here so you can see it better. I will use this table to develop themes in the grouping codes worksheet. One important thing to know about this table is that while you only see the broad codes when you first open it, you can click on the plus sign next to each broad code, and it will reveal the specific code. See the plus here to the left of the vaccination broad code. When you do that, it will open up the specific codes underneath it. So I'm going to show you what that looks like now. Now that I've clicked on it, you can see that the broad code vaccination now has a minus sign where there used to be a plus sign. The specific codes underneath it also have a little plus or minus sign on the left side. If you see a plus sign, then the text segments are hidden. If you see a minus sign, then the text segments assigned to that specific code are listed underneath it. You can see underneath also that each section shown here in a red box is a coded text segment, as we discussed before. I also want to pause for a minute and explain something else in the slides. You may notice that the text segments get a little cut off in the slides, like over here. When you're using the Excel tool yourself, you can either widen the column or use the Wrap Text button that wraps the text around to the next row. I chose not to do that in today's presentation because the rows and columns will get too large to fit on a slide. So many times you'll see it get cut off like this. But do not worry, the full text is in the cell. It's just that you can't see all of it on my slide. With our specific codes and text segments showing, let's start to review them for ideas about a possible theme. The first specific code is lack of clear information or understanding about vaccination. So we want to ask ourselves, does this make us think of a possible social factor contributing to measles spread? Yes, it does. It makes me think of vaccination, but really, I want to say something more useful that more fully answers our question than just the broad code of vaccination. Since vaccination is an important way to prevent the spread of measles, but I would like to say something maybe that gets more at the underlying social factors like inadequate communication and knowledge about measles and vaccination. We may revise the wording of this as we go, but this is the idea. Each person may come up with a slightly different idea for a theme, and that is okay. What's important is that it clearly relates to your text segment coding group and that others can see why you came up with that idea. So here's my idea for a theme, and I write it in the theme A box. Inadequate communications and knowledge about measles and vaccination may contribute to spread of measles. And here is what our grouping codes worksheet looks like, zoomed back out, with only the broad code showing in the text segments table. You can see that the theme is there, no matter what is showing in the text segments table. Now I am opening the text segments table so that the specific codes and the text segments are shown. I've also zoomed in again. Here we see the first coded text segment group, lack of clear information and understanding about vaccination. Since we know that that belongs with theme A because we used it to create theme A, we're going to copy and paste it into the theme A box. Now we go to the next coded text segment group with the specific code vaccination, negative stories, and rumors. And again, we ask ourselves, does this second code text segment group about negative vaccination stories and rumors fit with theme A? And remember, theme A is inadequate communications and knowledge about measles and vaccination may contribute to spread. I would say yes, because stories and rumors are closely related to knowledge and information. When knowledge is low, rumors are more likely to be believed. So I'm going to say yes. So I copy and paste that text segment coding group under theme A. The next specific code is helpful if vaccination comes to the community. Does this support the idea that there's a problem with knowledge and good communication about measles and vaccination? Does it support our theme A? I would say not really. This seems to me to be more about ways to make it easier, logistically, to get vaccinated. It's important, but it's a different idea. We could even consider creating a second theme, ways to make it easier to get vaccinated, as theme B. So now I have put theme B, more could be done to make it easier to be vaccinated, in the next space. And then I copy this coded text segment group into that theme. So this is how you make your themes. Back to our table with the coded text segment groups. The next one, vaccination not promoted enough. Does this fit with theme A? Inadequate communication and knowledge about measles and vaccination may contribute to spread. I would say yes, because promotion is a kind of communication. Promotion is effective when you have good communication. So that gets grouped with theme A. After that, we have vaccine supply shortage. This does not relate closely to our theme about communication and knowledge about measles and vaccination. So we do not copy it and paste it under theme A. So you can see the process. We read each group in the table to the left. If it fits with theme A, or now, with our new theme B, we copy and paste it into the box to the right. If it doesn't, we skip it. We go all the way to the end of the vaccination broad code section. When you have gone through all of the specific codes in the vaccination broad code, you can click on the minus sign to the left of the word vaccination and it will hide them all. You can see it has hidden them, but you still have all of the text segment coding groups that you copied under theme A. Then you will open the next broad code, community environment, and use the same process. Read, decide, copy, and paste or skip. I will just show you the first one under the community environment broad code. Information passes informally. Here we will decide if it fits theme A, inadequate communication, or theme B, more could be done to make it easy to be vaccinated, which is over here. Or if not, maybe we would think about creating a theme C. So I will stop the process here, but this is how the process works all the way through all of the broad codes. Now we're going to zoom ahead in time and imagine that I have used this process with all of the broad code groups in the table, and I've come up with 6 themes using our text data on the measles investigation. As you know, the first one is inadequate communications and public knowledge about measles and vaccinations may contribute to spread. And our theme B is more could be done to make it easy to get vaccinated. I also created a C, vaccination program may be having operational problems. D, community may be willing to do more to prevent outbreaks. I put a question mark because I'm not sure, but there were some indications they might be. E, healthcare access might be a problem for disease detection. And F, school as a source of infection. Can we do better? Meaning in the school system, can we do better to prevent infection? In this table, you can also see all of the coded text segment groups that go with each theme. And it would continue down below the slide. There are many more, but you get the idea of how they all fit into a theme. But I want to stop here because you might be wondering, why do we need themes to group our coded text segment groups? Aren't these text segments and specific codes already grouped into a broad code? The answer is that broad codes do not contain enough information to answer our research question. They are much more broad, and we use them just to organize our specific codes when we start, so that we don't have a big disorganized mess at the beginning. It is only after we have coded all the important text segments and we look at how they group into specific codes that we can create accurate and useful themes. Here is a good comparison of broad codes and themes from our own measles example. On the left, the broad codes from our coding scheme. And remember, broad codes are our temporary way to organize specific codes. We have measles characteristics, child characteristics, family environment, school environment, community environment, medical diagnosis and care, vaccination, and public health communication. On the right, you can see that our themes are more statements that answer our research question. And I've just taken 3 from our list of themes. A, more could be done to make it easy to get vaccinated. B, vaccination programs may be having operational problems. And C, community may be willing to do more to prevent outbreaks. So, to review the grouping code section, coded text segment groups. Similar text segment groups grouped together as a specific code. This is an important concept that we want to remember from this section. Next, the idea that we build themes by putting similar coded text segment groups together, and then we create a theme that represents them. And also remember that themes have to answer our research question. And in this example, the question is, what social factors may have contributed to measles transmission? Before we go to the Building Themes worksheet, let's take a look again at our list of themes that we have. I won't read them again, since we've read them several times now. But looking at this extensive list, you can see how qualitative analysis gives you a lot of information about a range of social factors that appear to contribute to measles transmission in this community. While you don't know which is the strongest factor, you do now have a list of possible factors to work with. Some factors you will want to evaluate further, and others may be ready for action. So, are we done? No, we are not done. While it's nice to have this list, and we know that we have analyzed the text very thoroughly, we aren't done until we can show how we came up with these themes. Others need to be able to see our work. This is where the building themes worksheet comes in. I will show you how to develop our evidence using worksheet 9, building themes. Here's the building themes worksheet. I wonder if we really should call this the building your evidence worksheet, because we have already gone pretty far in identifying our themes. Here we're going to write about the text segments and the specific codes with each theme and how they support the themes. So you can think of this worksheet as the last part of the building your themes section, or you can even think of it as the building your evidence worksheet. Either way, it has 5 columns, and the 5 columns represent 5 steps. I'm going to provide a quick overview of the 5 steps. Then I will go back and show you a measles investigation example. Step 1 is to paste your theme and all of the text segment coding groups that support it in this column. And here is a diagram that shows a theme with coded text segment groups. You just paste it there. I am zooming in so that you can see it better, both the theme and the coded text segment groups. Step 2 is called describing, and the directions say, write a sentence that describes what each quote says, or what you will see as important about it. This is what that looks like. The coded text segment groups are pasted in column 1, and then in column 2, you just write a short note next to each text segment. The reason that we do this is that in step 3, we will need to write a short summary of each coded text segment group. In order for your summary to be descriptive and useful, it's helpful to make these notes. I will provide an example using our measles investigation in just a few minutes. Step 3 says to write a short paragraph that summarizes the coded text segments for each specific code. Then it asks you to select 1 or 2 representative quotes from the text segments. So when you are done, you will have as many paragraphs in this column as you have coded text segment groups, in this case, 3. Step 4 is synthesizing. Here we summarize even more. It says, paste your text segment coding group summaries together for one longer description of the whole theme. So we put all of our paragraphs from step 3 together in this column, and this creates a detailed explanation of your theme. It describes all of the text that went into it using your notes and also provides some quotes. You may want to paste these into a word processing file or a Word document and edit it before putting it here. It's just easier to work with. Remember, though, this is just one theme. You will need to repeat steps 1 through 4 for each theme. And last, once you have summarized all of your themes using steps 1 through 4, the last step is to write up a full report. This is step 5, interpreting. The instructions say to reflect back on your research question and report on all of your themes here. While you are writing this, you'll be thinking about what you have learned and adding your thoughts about what is the most important or most useful for action in this document. Again, you'll probably want to put this in a text file for easier editing and for sharing with others. Now I will show you these 5 steps again using theme A from our measles example. Here you see that I have copied the entire summary of theme A from the grouping codes worksheet, and I'm pasting it into the first column of the building themes worksheet. And just a quick reminder of what the different sections are in this column. The theme is at the top, the specific code is next, then all of the text segments that go with that code are underneath. The specific code and all of the coded text segments form a coded text segment group. Once we have pasted the theme A and the codes in the first column, we will start step 2 in the second column, describing. The instructions say, write a sentence that describes what each text quote says, or what you see that's important about it. We begin by copying and pasting our theme and our first specific code in column 2. Now we will read down the list of text segments and write very briefly what we think each one means. The first text segment says, I honestly don't know much about the measles. I didn't know much about the measles vaccine before this. He got his vaccine when he was a baby, and we thought it was all he needed. Now that's kind of a long statement. If you're trying to summarize several statements like that in a short paragraph, it can be really helpful to just write a short note like, parents unclear about the need for a second vaccine. I'm more likely to remember that when I go to write my summary. The principle here is that when the text segments are long, or you have many text segments, it is helpful to summarize each one in a short note. The next text segment says, I think not all the children were fully vaccinated, as some parents did not go back for the second dose. Maybe they didn't know it was needed. Here I wrote, parents may not know that they need 2 vaccinations. Again, this is in your own words and it's just for you. It is helping you read and really think about the text segments. The next one says, I hear some parents were afraid of side effects, as after the first dose, a few children had fevers, and their mothers didn't want to risk another shot. I describe this as fever after the first vaccination scared parents. I won't read them all, but you just keep going down this way for the whole list. I continue down the list, reading and making notes until I get to the end of the coded text segment group. Now we move on to step 3, summarizing and displaying representative quotes. It says, write a short paragraph that summarizes the text segments for each specific code. Select one or two representative quotes from the text segments. Let's see how we can use the brief descriptions we used in column 2 to write the summary for column 3. So the 3 statements that I've highlighted in the red box: parents unclear about the need for a second vaccine, parents might not know they need 2 vaccinations, and the third one, parents might not know about the second vaccine being needed, are all similar ideas. This can be summarized by saying there were several comments about a possible lack of knowledge of a second vaccination. In the same way, the statements in the blue boxes, fever after the first vaccination scared parents, and parents might hear about bad side effects from others, need to know what to expect, both relate to fear responses and can be summarized together with parents saw their child have a fever with vaccination or heard about another child and this caused fear. In the same way, the green box statements also are similar and can be summarized together as a need for simple, clear messages that repeat through public media. In this way, you can use your brief notes next to each text statement to help you develop a more meaningful and detailed summary of the coded text segment group. And this is what we need to do in the next column. With these short notes, we've made it easier to write up our short summary paragraph. Because really, that's just the red, blue, and green summaries put together. The other thing that this step has us do is to go back over the text segment and see if we can find some quotes that really show our point. I like to use quotes that grab your attention and quotes that suggest some kind of action. Down below the summary, we will write a few quotes that we chose. I chose this one. Some parents also hesitate because of stories they hear, like the vaccine can make a child weak or sick. And if no one explains what's normal after the injection, they get scared. And this one, communication should be clear and repeated, as one poster is not enough, and we need to hear it at church, at school, on the radio, again and again, and it needs to say, it's free, it's safe, and you need 2 doses. So I copied them both over here. These I felt were powerful, and I wanted to have them appear in the final report, especially these little parts. If no one explains what's normal, they get scared. And this part that I especially like, talking about the vaccination. It's free, it's safe, and you need 2 doses. That is a wonderful message that comes right from a participant. Now we are in column 4 and step 4, which is synthesizing. The instructions say, paste your text segment coding group summaries and the theme for one longer description of the theme. To start, we will copy everything in column 3, like you see here, and then paste it into an empty word processing document. You can edit it in the column, but I wouldn't recommend it. It's easier to edit in a Word document or whatever you use for word processing. In Microsoft Word, it's easiest to paste it with the last option, which is unformatted, so you won't get the table in your document. This is an example of what the summary will look like when you have put coded text segment group summaries together with your representative quotes and have edited it. Each specific code summary has been written into a paragraph, and I have put the paragraph at the top, and then I have put each of the quotes that I liked underneath, and it makes a nice way of demonstrating your points in the summary part of the paragraph. Then you can just paste it all back into the chart, nicely formatted. Step 5 is called interpreting, and the instructions say, to reflect back on your research question and report on all of your themes here. This is where you will write a summary that combines all of your themes summaries into one report. To get started, just paste everything you've written for each theme that's in column 4 into, again, an empty word processing file and edit it so it makes a narrative report. I have zoomed in here with an example of what this could look like. This document is structured with an introduction at the top explaining briefly what you did and what your themes were in a list. And then underneath provides the detail that you have about each theme. You should also feel free in this report to discuss your observations or your thoughts about what might make the best next steps for action. But keep in mind that we have only worked through one theme. We need to do this for all of the themes that we want to include in the final report before taking that final step. So now we are done, at least we're done with theme A. We will want to develop our evidence for each of the rest of the themes using worksheet 9, Building Themes worksheet. So let's review some key points about the building themes process before we move on. This worksheet has 5 columns. Column 1 is for pasting your theme and the related text segment groups. Column 2 is to describe each text segment in your own words. Column 3 is to summarize each text segment group in a short paragraph with some selected quotes. Column 4 is to paste text segment group summaries together and to edit so you have a summary of the entire theme. And then column 5, when you've done columns 1 through 4 for every theme that you're going to include, you put them all together in to write a full report. Once we have developed our themes and developed our evidence for these themes, we have answered our research question as well as we can with this data. Some themes may provide enough information already to suggest taking action, while other themes will need further follow-up, like additional investigation to fully understand the issues. Either way, we're going to take one more step to finish our analysis, and that is we're going to go to our results and action planning worksheet. This is worksheet 10, the results and planning worksheet. Here we have recorded already our research question and the 6 themes we've developed. When you use this, you'll have to enter this. For the first one, I'm going to work across the page, answering the questions in columns 1 through 4. I'm going to demonstrate how we can fill out these columns. For theme 1, a lack of public awareness of measles and about the need for 2 vaccinations. Column 1 asks, how will the knowledge be used for action? I can imagine one use, a new measles awareness campaign. This would have new strategies, new communication channels, building on the information that we learned from our analysis. Trusted people in the community and participants like the Red Cross who said they would be willing to help provide information. Column 2 asks, who could implement this action? Here, I put the local public health agency, radio stations, Red Cross, maybe the schools. Column 3, how do we turn this knowledge into action? In other words, how do we get started? I'm saying that we would need to hold a meeting among all the stakeholders mentioned in column 2. Column 4 asks, how do we communicate what was learned? Specifically, who are the contacts? So if I was using this myself, I would actually write in some names of the school head teacher and the Red Cross representative and other people I knew and their contact information so that I could actually get started. So I'm going to stop here because we've covered a lot of material today, and I think that filling out this planning sheet is very straightforward compared to the other things that we have learned. The only other thing that I want to say about this sheet is that when you're thinking about how the knowledge may be used for action, notice that the different themes represent a broad, excuse me, let me go back here for a minute. That these themes represent a broad range of possible actions. So it isn't just going to be a communications campaign. It could be helping improve programs. It could be addressing organizational issues that are causing problems. So think broadly when you're answering what can this knowledge be used for action and in what way. So now we've come to the end of our 4-part webinar on collecting, analyzing qualitative data as part of an outbreak investigation. Part 1, which was presented by Valerie Mack, was collecting qualitative data important to field investigators. And that included collecting and recording field notes, interviews, and focus groups. Part 2 was analyzing text data and how to get started. And I shared with you the planning and organizing worksheets and how to import text. Part 3, Kira presented today, which is text coding for qualitative analysis. She showed you how to code, and she showed you how to use the tables and the important quotes worksheets. And lastly, I've just finished completing with you building themes in qualitative analysis. In here, we've built themes, we've built our evidence so that people can understand why we developed those themes, and thought a little bit about planning our action. On this slide, I'm just showing you the YouTube tutorials available to help you learn how to use the Excel tool for thematic analysis on your own. We will also be sharing a version of the tool made specifically for your measles investigation example. You can watch these tutorials and use the Excel tool version to review all of the phases that we have reviewed in this webinar. There are a total of 9 tutorials, and each one is less than 10 minutes. So now we will go on to questions.
Thank you so much. I want to give a huge round of virtual applause to Dr. Julia and Dr. Kira. Lots of positive feedback coming through in the chat. And in the last couple minutes, I would love to take a few questions if we can, and then we'll close with a couple final reminders before we close the webinar for the day. First, I will say we had a lot of questions about how to access the part 1 of this webinar, which covered part 1 and part 2. So that has been copied and pasted into the chat multiple times. In addition, you can find a copy of the thematic tool and Excel workbook in the chat, as well as links to the YouTube tutorials and the thematic analysis tool. But with the remaining time, I would like to ask a couple questions. The first one is coming to you, Dr. Kira, on how to develop a coding scheme before the study. Can coding schemes emerge during the transcript management as well?
Yeah, great question. And the reason we didn't go into it is because it could be its own webinar to really get into the sort of meat of how to develop a coding scheme. We have 2 YouTube tutorial videos on how to do it. But just briefly, the idea we have in our tool, we have set up some pre-developed coding schemes. So you can, if those fit your data, you can take those and customize them to sort of fit the specific scenario you're trying to use them in. If they don't fit, it is generally we develop them from the data itself. So you maybe go through and write short codes, for maybe 100 or so text sentences. And then from that, you use that information to develop a coding scheme. And as you go, you're going to find that you continue to sort of add codes and adjust your coding scheme based on what you're seeing in your data. So like I said, there's a lot of great resources out there for developing it. And we have some specifics on how to actually set those up in our tool on those YouTube tutorials.
Excellent. Another question for both of you is about the tool for qualitative data analysis. Is Microsoft Excel or Google Sheets easier to manage and analyze for qualitative information when compared to other tools such as NVivo, Atlas.ti, or MaxQDA? What are your thoughts?
I'll answer that question because this gets at why we developed it. No, it's not necessarily easier than NVivo and those others. The difference is that it's free. When we started this project, I think maybe 5 years ago, we were working with the International Federation of the Red Cross and also the Red Cross Society of DRC. A shout out to them if they're out there. And we wanted to create something that everyone could use, and it was also during the Ebola response. We didn't have the time to be searching for licenses for everyone. So this is really just a free open source alternative. And I would want to emphasize that what you learn with this tool can easily be used with NVivo and other licensed materials. It's as much a method and a process as it is a tool. And, if we had more time, we would talk about that as well. But please learn what you can here. And if you'd like to use a licensed tool, go ahead.
Excellent. Thank you. And one more question, because I think that's all we have time for. Does one person who's an expert in qualitative data need to do all of these steps, or can multiple people work on this thematic analysis tool at the same time? Thinking about confusion that could be created with these groupings and data.
I could start with that, Kara. I think working in a group has a lot of advantages. And we try to do it whenever we can because there's a lot of value to presenting your thematic groups to other people and say, does this make sense? Is my evidence persuasive? But the person asking the question is absolutely right. There is also more possibility for confusion, or it takes more time to make sure everyone is using the same coding scheme or interpreting it the same way. So I think I would say you can use it both ways. An individual can do it on their own, or you can do it in groups. It does take a little bit more time to do it as a group, but I think you can be more sure that you have kind of reality checked all of the work internally before you share it with others if you work in a group.
Yeah, and I just add very quickly that generally you would want to put one person sort of in charge as the organizer and an ultimate decision maker on these things, sort of your lead
The
analyst.
tiebreaker.
Yes, to be in charge of it. But yeah, there, like she said, there's a lot of advantages to doing it in groups.
Excellent. Well, thank you both so much once again. This was a wonderful webinar, learning so much more about qualitative data analysis and this amazing thematic tool. So in closing, in our last 2 minutes, I just wanted to share these quick updates and reminders about upcoming FETP webinars. So you can see that 1 week from today, we will have our Healthcare Worker Performance Improvement webinar. So tune in for that on September 3rd, and then on September 17th, an Informatics and Data Visualizations for Field Epidemiology webinar. And as usual, if you would like to be featured in our next technical webinar, you can email askgwdb@cdc.gov to share photos of your FETP trainees in action with a brief caption, and perhaps we'll be showing that on one of our upcoming webinars. So thank you all again. The links for this have been shared in the chat. So please stay tuned. There will be a follow-up email with all of this information. And thanks to our amazing presenters, and thanks to all of you who joined today. Hope you all have a wonderful rest of your day wherever you are in the world.